it's not a lifetime commitment. It's a lifetime decision. Like, I don't want to come off of it because it affects all of my life. It's expansive. Again, if it's the only issue you have from a health standpoint, it is expansive. Your ability to be a father, a husband, whatever job it is that you have I mean, I think you make more money if your sex hormones are optimized. Let's just put it that way, because you can think more clearly, you have more drive, you just want to do more things. I mean, I opened 2 Stark locations right after I went on TRT. I don't think we would be where we are today without TRT. And that Stark is fueled by TRT.
Are there any other supplements to pair with, both for men and for women? And there are a few questions about men and women here, but are there any other supplements that you guys suggest pairing with to help as you're supplementing with TRT?
If you're on TRT, you're getting pretty good amount of testosterone into your system. However, like if you're looking to sort of optimize your testosterone levels naturally through supplementation, there's definitely things that we want to build up, certain nutrients such as like omega-3s, vitamin D, zinc, L-carnitine. These all have some role to play in hormone signaling, hormone production, as well as building up hormone receptors. Also, making sure you're eating well, sleeping enough, stress management, all this kind of stuff is really important foundationally to, get the best hormones that you can, whether you're on or not on TRT. We do bring in, some other medications depending on the person who's on the TRT. For instance, if someone wishes to keep their fertility, we can also pair something like HCG or enclomiphene or Clomid to maintain testicular function if our patient wishes to keep their fertility, because testosterone, when you do enough of it, will inhibit the signal suit for your testicles to make sperm.
If we can take a step back to the indication of whether or not you have low T, there's a little nuance in there that I'd like to make sure the audience is paying attention to. And that's that our standards are to bring you or to contrast you to what an optimal male looks like, not an optimal 55-year-old male or even a normal 55-year-old male. And I only bring this up because I get lots of questions about this. Hey, I just turned 50. I went to see my doctor. I can't get out of bed. I don't have any drive any longer. He said I'm fine when he looked at my sex hormones. He said I'm normal. The difference is in our standards and why, as compared to what would be considered a normal 50-year-old or even a normal 30-year-old, is very different than what a normal 30-year-old was in the 90s, for example.
The ranges of testosterone that you look in the labs it's really huge. So one lab that we use, the range is from 184 nanograms per deciliter to 1350, so 1,315. So as you can see, any sort of conventional doctor who's not trained in hormones, they'll take a look at those ranges. And that if you come in at 200, they're going to say, you're normal, you're fine, and they're not going to treat you. So I can tell you from experience, when our patients go from 200 to 1,000, they definitely feel a difference. So that's for the total. Now, the free testosterone, as Dr. Jihan mentioned earlier, is actually the more important number. The range for that is actually between 2 to 30. I think Todd can speak to this. In our call, he's the one who's been experienced what a 2 feels like of a free testosterone versus a 30.
Actually, just to be more accurate, I know what it's like to not have measurable free T, not even 2 free Ts to rub together to make a spark. And that is like, you're afraid of everything. You're full of anxiety. You have a heavy degree of depression. As I was in that state, which we did on purpose to me, by the way, just to kind of experience what that was like, I wanted to go on Prozac. I was driving more slowly. I was afraid of getting in car accidents. I was afraid of getting rear-ended and afraid of bumping into somebody in front of me. If you tapped on my shoulder and came up from behind me, I would flinch because I was just scared. I remember thinking, I can't believe I got married again. I remember thinking, this is preposterous that I am running a business like Stark. I'm not able to do that. It was right around one of our Christmas parties. And I told Alice, I'm too scared to do the speech. It was an overwhelming experience. And granted, most people experience that slowly over time. And so I don't think there's a recognition that they are in that state. In my case, I went from optimal to that within about 3 weeks. And so I had a reference, I had context. And it was horrific. Up until that point, I experienced, like most men do, andropause, going from probably my early 30s, but I don't have measurements back then or lab results back then for me, to the age of 50, right around 50. And by the time I turned 50, I was at free T of about 3, I believe. And so then as I started hormone replacement or testosterone replacement therapy, I went from 3 to 15 in the first month. And I felt like I was shot out of a cannon every morning. I mean, it was a shocking change. And then I went from 15 to 25, which is in our target range of between 20 and 30. And between 15 and free T of 25 was another shocking difference. And most of it was in my head. I would describe as a patient going on TRT, it's a brain hormone first. Like those were my first indicators that something was happening. And what happened was I felt happy, at peace. I felt like I could remember everything, which is how I feel right now. So my recall went from questionable to exceptional. I probably was able to do math better as compared to when I had really low free T. Everything seemed easier and more joy-filled. That was the overarching experience of going from really low T to optimal testosterone levels. And it's a very exciting thing to go through as a 50-year-old male. I'm 56 now, so it's been 6 years since I started. The spectacular part of the experience is that you have the wisdom that you've accumulated, but you have the brain power of a young person and the drive and the enthusiasm of a young person, which is it's better than when I was young and had it naturally, honestly, because I have all of those life experiences to go along with the experience of having optimal sex hormones. And you have to understand that it's also coming from my case. So my case is kind of unique in that everything else was solved for, meaning my diet was optimal, my sleep, I protect very tightly, making sure I get good quality sleep. My body composition was really good. I was probably, I think, about 17% body fat at that point in time. My strength was good. My joints kind of ached, frankly. My drive was a little bit questionable. And those were, in hindsight, related to my indications of having low testosterone. So everything was solved for except for that one barrier. And we just kind of plucked that barrier out of the way. And then it was like game on. So that's what it's like to go from low T to, or less than 1 or 3 to optimal ranges of 20 to 30.
There's a lot of side effect questions, Todd. And so you having firsthand experience of a full turnaround is really, you can really, really speak to it. And then you have the medical experts to speak to the why and the how of some of those things. One question, a cheeky question that was asked is, how does Todd have such great hair? Because I think a common misconception is that, and it may not be a misconception, but is that, TRT can cause hair loss. But why does Todd have such great hair? And so if you can speak on firsthand, and every body is different, and we know of certain side effects that may have come up, but it feels to me, having heard what you just heard, that the pros drastically outweigh the cons here. So
I didn't lose any hair, but this whole thing is not nearly as glorious as it was when I was in my 40s. It was like, I love looking at pictures of myself from back then. It was really thick. And it was really thick, actually, into my early 50s, right up until COVID hit. And it's not as nice as it used to be. Like, it's a lot thinner right here. I lost some hair when COVID hit. And the theory is it was the stress related to trying to run a business during a time when it was so tumultuous. It was really a difficult, trying time. And so it's got nothing to do with my testosterone therapy.
Yeah, Todd touched on this. So testosterone, one of the things that it converts into through the enzymatic activity of something called 5-alpha reductase is DHT, or dihydrotestosterone. And this has been sort of the much maligned form of testosterone that people are really worried about with hair loss and prostate cancer. But as more and more research comes out, it's simply not shown to really be true. So DHT, one thing that it can do, or purport to do, is shrink your hair follicles, which could cause them to fall out. But really what we're seeing more and more of is that this is more genetically predisposed. It's not the actual DHT itself, it's your genetically coded sensitivity to the hair follicle sensitivity to the DHT, right? So, and that means if you have male pattern baldness, like in your genes, that's probably an inevitability anyway. If you have TRT that increases DHT, and you have that predisposition, that can definitely happen and maybe speed it up. But it's not the case if you don't have that genetic predisposition necessarily. The easiest way to explain DHT is it's like your most strong form of testosterone. It's like your testosterone on steroids.
That's funny, a steroid on steroids.
Right, exactly. So it's really necessary for, brain health, for energy, for vitality, for muscle growth, all that kind of stuff.
So DHT, you would probably agree then is important now for the experience of life that you're having right in the current moment, but probably also something to really make sure is optimal for 30 years down the road, like all along the way, because of the damaging result of having low DHT over many years. Is that right?
I would say you would not want to suppress your DHT. And even if your hair is going to fall out, it's probably worth not suppressing your DHT.
Yes. Yes. And so let me just jump in on this. So we've got these guys that are genetically predisposed to losing hair because of DHT, right?
Well, really their hair follicle sensitivity to DHT.
Right. It's why finasteride works, right? It's actually suppresses your DHT, as I understand it anyway. And it's a very common medication. The MDs that I see or read about that are discussing this drug with their patients or with the general public state that there's really no major adverse side effects. And so that doesn't ring well with me, because the adverse side effect is suppressing your DHT, which is all of your maleness, the part of your hormones that gives you the things that you described, which are so critical to having a full life. And if you suppress it, you don't get those things, right? And so they're putting patients that are 30 years old that are losing hair on this DHT blocker, on finasteride, which is shocking to me, because it's going to lead to a 35-year-old very unhealthy male, and lead to, as my friends have described to me, they have experiences of low T, like not as aggressive as I described when I didn't have two free T's to rub together to make a spark, but definitely symptoms of like just being down, not having energy, not having drive, not wanting to do anything, changes in their body, like more fat around the waist. These are the things that they described to me. And I'm assuming that some of that is connected to the fact that they're on finasteride. They have glorious hair, by the way.
I actually have a couple of patients. There's something called post-finasteride syndrome. And you were saying, maybe some of these effects of not having enough DHT aren't as bad as when you had zero free T. But for people who have post-finasteride syndrome, it's probably worse. They will have irreparable nervous system malfunction, like their brain's not going to work well. They'll have irreparable decreased libido because that 5-alpha reductase, that enzymatic blockage was so strong, effective, so strongly that they lose all that stuff. And I'm working with a couple people who are experiencing those kind of things.
I don't think, because I've had so many conversations like this with people I'm close with, I don't think I'm going to change anybody's mind. But the options, as I see them, are you can keep your hair or get it back, because in many cases you can actually restore hair with finasteride, or you can be optimally healthy, but you don't get both. If you need finasteride to restore your hair, you don't get both. You have to give up your hair, or you have to give up your health.
I'd say for the most part, yeah. There's some stuff about like certain shampoos with ketoconazole that could help, and there's a lot of different treatments for hair now. You hear about you'll go to Turkey for hair plugs and stuff like that. So.
Yeah, I mean, you can do that.
But yeah, I mean, I think ultimately, if you're really worried about your health, the DHT is not something that is opposed to that, whereas I believe the finasteride could potentially be opposed to that long-term health that you're after.
Okay.
Yeah, we've definitely seen some obstacles to body composition goals for patients who are actually on Propecia or finasteride, and having that conversation with them and trying to get them off of it is quite difficult. But we have been successful for some patients in taking them off of the medication, and they end up, of course, progressing in their fat loss goals.
Also related to this, if you're on finasteride and you're experiencing some symptoms of low T that theoretically can be connected to that, and that would include depression and anxiety, it's not uncommon for a male or female that has depression to go to their doctor and get prescribed an SSRI, right? And so they're dealing symptomatically with that depression. It seems like most people don't understand that there's a bidirectional relationship between things like metabolic syndrome and mental well-being. And so by that, I mean, if you have mental illness that's related to low T and you go on SSRIs, it can create metabolic syndrome. And if you create metabolic syndrome, it can create mental illness in the form of something like depression. And so it kind of goes back and forth, and the circumstances can just get worse and worse. Your body falls apart and your brain follows suit, or your brain creates the destruction in your body, and it just kind of snowballs. It's scary. It's partly why I believe that people should approach their health with such a high degree of urgency and not wait, not think like a younger person and think things are just going to get better, but take action.
I think one thing that in our natural progression here, having laid this out and gotten your firsthand experience, Todd, and thank you for that, and some medical background on most of the side effect questions that are in here, and there are some others as well. But Stark, and how you guys approach. So you take a blood draw and you identify, and then you have a conversation with the patient as to whether or not they want to pursue this treatment. You may make a recommendation that it'd be very good for them. What does that look like? What is the first 30 days or 60 days or 90 days of TRT? How is it administered? How are you monitoring the side effects? How are you monitoring the blood? What are you checking in on? What is that like? Should I come to you and say, I'd like to do this? And I can wipe one of the questions out right away, is that at any point when you identify that testosterone is below normal levels or below an ideal level, this could be an option, correct? Because there's a lot of questions about age. I'm 35. Am I too young? Is 50 too old? So it feels like it's something that could happen at any time. You guys make that identification. What are those first 30, 60, 90 days with Stark on TRT like? What are you guys doing with your patient to help them along the way, to monitor them, to really check in on how things are going?
I think there's a big misconception that you just inject yourself into testosterone, and with testosterone, you turn it into this enormous version of yourself. And it's just really not that effective as a singular treatment. And so the general concept of Stark is that we approach the problem holistically so that they can have an experience like I have. So I have friends, family, even students at Stark who have optimal T levels, but they're not getting the leverage of it's like Dr. Jiha puts a sledgehammer in your tool kit, and you can opt never to pull it out and use it. So there's a lot that goes into it.
Yeah, I'll say, and I think everything starts off with foundations of health, right? If you are eating like crap, if you are sleeping like crap, if you have horrible stress, you're drinking booze all the time, you could add testosterone to the mix and it might help you get a little bit better, but really it's not going to really get you to like the level of Todd, for instance. So we really want to fix those things first and foremost, because that you can't out supplement, you can't out medicate poor foundational health. Things just catch up to you and you don't get what you want out of it, right? So we got to make sure the nutrients are in, we got to make sure you're sleeping, you're eating right, you're exercising, all that kind of stuff. And then if your T levels have not improved through those and you're still having some of these low T symptoms, your numbers still aren't that good, then we can look at TRT for sure, depending on your age, fertility status, all these kind of things. There's some nuance there for sure. Once I put someone on TRT, it's not like, okay, you can do whatever you want now. Again, tell them, hey, I have some guys on TRT and you would never be able to tell, right? Because they are not consistent. They don't keep up their end of the bargain. And then you move the needle a little bit. Let's say you're 50% consistent, they get 70%. Then that TRT started to work for you a little more. You get to 90%, that TRT is working for you a lot more. One way to look at it is it's like going to amplify the rewards that you get from the efforts that you put in, right? So that effort better not be shorthanded either.
That's a great answer. And so it's administered daily. And how often are you checking the blood work? I want to understand that too.
There's some people who will do daily. We started experimenting with daily microdoses of injections for Todd. So what would have been, like, for example, back in the day, I think he was doing 0.3 cc's injection twice a week. We decided, okay, let's see how you feel if you actually had a 0.1 injection Monday through Saturday. And, Todd, you can speak about this, but, how did that compare between the daily injection versus the twice a week injection?
The thing I love about it is it narrows it down to a singular pharmaceutical. So as I understand it, when you inject yourself with a half a week, or if let's say you go to your doctor and they give you a monthly injection, you get this giant spike in testosterone, and some of it gets converted through the aromatase process into estrogen. And theoretically, it can become too high. And so you take a second drug to prevent your estrogen from getting too high. And the reason I love daily injections is because I don't have those giant spikes. And so not as much of that testosterone then can be aromatased into estrogen. And I don't have to take that additional drug any longer. So for me, that's well worth doing daily injections. We went from 6 days a week to 7 days a week because my T levels were a little bit too low, because a bit more of it was being converted to estrogen. So now my estrogen is at the high end of optimal, and my testosterone is right in that sweet spot between 20 and 30. And I inject 0.1, which is a little tiny amount, 7 days a week. If I miss a day, it's not a big deal. But that's how, in my opinion, that's the optimal form of delivery because of the absence of that additional med. Some people may disagree because it's more frequent injections. It's been 6 years for me, so Like the injection part doesn't bother me like it did when I first started. So yeah, that's how I feel about it.
We retest our patients 1 month after their initial injection. We want to make sure that's the right dose. We want to make sure that they're not overly converting their testosterone into estrogen. And after that first month, then we'll retest them. We'll adjust the dose, retest again in that second month. The dose of testosterone is based off of the patient's size and weight. So the amount that's needed for a person like Todd, who's about 165 pounds-ish right now, is a lot less than if he was like, 300 pounds. And also their activity as well. So patients will go through and utilize their testosterone at a higher rate if they're just more active. They're more sedentary. They're actually not going to go through it as quickly. So that really depends on the patient. So after we get that right dose, then we will drop it to once every quarter, testing. But we want to monitor that because sometimes patients will get injured or they're not working out as much. And then you'd have to adjust the dose so that's appropriate for that patient. So this is it's overkill compared to other practices, but this is one of the most powerful medications that we doctors can actually prescribe at Stark. So we really watch our patients very, very carefully to make sure they're safe and they're really kind of getting the most out of their injections.
Great. And Zane actually had a great follow-up question here that said, if you start TRT, can you stop TRT treatment and maintain elevated levels, or do you have to maintain TRT in perpetuity?
So if you start TRT, can you stop TRT treatment? I mean, yeah, if you start something, you can stop it. But what happens when you stop it? And this actually goes into what Dr. Alice and Todd were saying about, the frequency of dosage. The less frequently you dose, the higher the amount you're going to have to inject is, which means that large amount of testosterone you do twice a week or once a week or whatever is now going to it's going to inhibit your brain signals to create your own testosterone after a certain period of time, right? So is that something that's reversible? The vast majority of guys, if they get off the testosterone, eventually their own inner machinery will reboot. How long that takes really depends on yourself, individual, as well as, how long you've been on it, how much you've been taking. But be prepared, especially at that beginning, if you just stop taking testosterone after being on TRT, your levels are going to drop to, very, very, very low, if not zero for a period. To avoid that, and we've had a handful of guys who had to come off of TRT for a variety of reasons, some for like their wife would have another kid or something like that. We do employ the use of some other pharmaceuticals, one being HCG, brand name Pregnyl. Another could be enclomiphene, which could sort of restart that inner signaling that you have to create testosterone and sperm. So that is one option for sure. Most of our guys, they really love the results they get with the testosterone. So I think that's another reason why they tend to stay on it long term, as well as the health benefits. As you're getting older and older, there's a ton of health benefits.
I delayed doing TRT for a while, probably 2 or 3 years, as it continually started coming down, because I was afraid of the idea of it being a lifetime commitment. I just don't like the idea. Go on a pharmaceutical for the rest of your life. And I don't see it that way at all any longer, especially because I came off of it. We have protocols to make it more gentle. I mean, I just did the hardcore version. And within a couple of months, I was at what I would describe as probably optimal 55-year-old testosterone. And we could have maintained it there. And then we got a little bit higher. I think my total T was in the 700 range at one point. And I decided that I want to go back to the other version of Todd, so it's not a lifetime commitment. It's a lifetime decision. Like, I don't want to come off of it because it affects all of my life. It's expansive. Again, if it's the only issue you have from a health standpoint, it is expansive. Your ability to be a father, a husband, whatever job it is that you have I think you make more money if your sex hormones are optimized. Let's just put it that way, because you can think more clearly, you have more drive, you just want to do more things. I mean, I opened 2 Stark locations right after I went on TRT. I don't think we would be where we are today without TRT. And that Stark is fueled by TRT and Todd, basically.
I want to comment on this too. Collectively, between the NMDs at Stark, we actually have about 95 patients who are under our care for TRT. And many of them have been under my care for 7 years, ever since I started prescribing. And the amazing thing that I've seen with these patients is that when they first come to us, we diagnose them, we find that they have low T, and they come to us in their 50s, late 40s, maybe 60s, and they're saying, I think I'm going to retire. I'm really tired. I don't have that drive. And, my brain's not working as well as it should. And I'm like, well, give it a second. We optimize their hormones. We get them to train. We get them to eat better. And then suddenly they come back to me at the 3-month, check-in. They're like, yeah, I just sold my company. I bought another one. I invested in another. And I was like, I thought you were retiring. They're like, no, I'm actually ready to go. I can go and do some more stuff now. So a lot of people think that testosterone is just like muscles and, bodybuilding and this and that and losing fat. And while it does have that effect there, a lot of people don't fully understand that this hormone is actually a brain hormone, like what Todd was mentioning earlier. So it does have a powerful effect in the brain. And in fact, if I take the most pathological case, I have a colleague who owns and runs an Alzheimer's dementia practice, an inpatient dementia practice. One of the first things that they will do to these dementia patients is actually optimize their hormones. So they'll give them testosterone in their end days. And in fact, they will be symptomatically better well enough to actually go back and live with their families again instead of the inpatient facilities. So I think it's very unappreciated. I know that's not what we typically treat here, but I will say that the oldest patient that we have on TRT right now is like 83 years old. And he's training. He's doing great. He still works, by the way. He's a doctor.
Who I would call the godfather or grandfather or something like that, the OG of TRT, is Dr. Abraham Morgan Taylor from Harvard. He talks about embarking on the TRT journey as a trial. Like he would say, whether or not your labs indicate and how you're feeling indicate it, that you should consider a trial of treatment. And so by the very nature of that description, yes, you can try it and then decide it's not for you. And that sometimes happens, I guess.
I just had, I think in the past 7 years, I've only had that happen twice. They go on it and they actually don't do well with it and they end up coming off of it. But that's only happened twice in the past 7 years.
And Stark has been offering TRT for how long now?
7 years.
In all 7, okay, that's amazing. Can you treat people from the East Coast, or do they have to be local to one of your facilities? Is there a telehealth consultation and blood work situation that you guys can set up? Or
this is a controlled substance. There are rules and regulations around prescribing a controlled substance like testosterone. And usually the rules around T is that, and I believe it's beginning to change a little bit more since COVID, is that the patient does actually have to be evaluated in person at the facility. Todd, you can speak about our future plans for Stark when it comes to the 50-state PCT if you want.
It's not going to happen in 2024, but in 2025, we'll have the ability to serve all 50 states. We're just not there right now. It does lead to another question. Well, how do you identify a good TRT doc, or even just as valuable, how do you identify whether or not your existing primary care physician or specialist that's treating you is not good at it? We can expand into that. I think that's really helpful information for those that are chiming in from around the country.
Very fascinating to kind of what you guys spoke about earlier about how different doctors read the different range of what comes back in this blood work, and also what Stark tests, things that I've never had tested that Stark tested for, that were very informative in my journey with you guys. So I'm really grateful for that extra information because it gave me a leg up on getting better. From a financial aspect, can this be covered by insurance? Have you seen TRT be covered by insurance as therapy?
It is. It can be covered if you were overtly deficient. So you're below, remember, like a lot of these conventional doctors, if they see that you are at 250 and the cutoff is like 200, but you have symptoms, most of these doctors, if they're not well trained, they receive the continuing education in hormones, they're not going to treat you. However, if you do get insurance coverage, what insurance will do is that they will advise once a week, maybe, or twice a month, or once a month injection. And as we discussed earlier, whenever you have that low frequency of injection, what they're doing is that they're injecting an enormous amount of testosterone. So you have this massive spike, and then it declines over a period of time, and then you feel like crap. And then finally, 1 month later, you get that big giant injection. And then of course, that whole thing happens again. You're going to get massive mood swings from that. So one of the kind of bad raps of testosterone replacement therapy is that people are saying, oh, what about roid rage? Are you near roid rage? If every single one of my male patients actually had roid rage, I would not treat them. I would not offer this as a treatment. If anything, our men are, for the most part, are super chill, super calm, very happy, pleased with what they're receiving from treatment. But we ensure that their treatments are like even. So their levels are very even throughout. They're not having these massive swings all over the place, but that is actually what insurance will cover. So insurance will not cover things that's best for the patient. I will say that. They will do things that will benefit them when it comes to a financial standpoint, or what's maybe easier for the doctor to administer, but it's not what's best for the patient when it comes to outcomes.
To add to that, I'll say I've had someone, who was under my care and then had to stop and go towards conventional medicine because they actually, want to get it covered by insurance. The insurance system, the conventional healthcare system is not going to put you at levels of testosterone that is best for your well-being. They will put you to suboptimal levels. A, because like Dr. Alice said, they don't have the education, they don't know the research behind it. And B, like they don't want to make you feel optimal. They want to keep you in that system. Right. So that person came back to me. They're like, oh, my doctor says I shouldn't go above like 600 total testosterone. Like, did they check your free testosterone? No. Like they're just not well versed in this stuff. And also they said the monitoring wasn't nearly as stringent as what we do. Right. So that's what, paying someone who's a specialist will get you that the insurance and conventional medical system won't.
So the question's asked, what is the cost? I'm sure it varies depending on dosage and so on, but a general ballpark of to be on TRT in the way that's actually optimal and not suboptimal. Is there a ballpark cost that you guys can throw out there, or is that too hard to determine? Is it wide?
Oh man, like I've actually heard some practices. Oh, Dr. Jihad, you could talk about what patient that was charged, how much he was being charged.
I'll bring a couple of examples that happened recently, actually. So one new patient asked how much TRT was with us. And he told me he was paying $1,000 a month for this. So signed a year-long contract for $12,000. Then we told him our prices, which are $400 a month. The range is vast, right? And then the care that you get is vast as well. Another patient I had said he's paying $675 a month for androgel, which is the cream, and his testosterone levels are hardly above the lowest normal range, right? So it really depends, but we charge $400, and that includes the medication, all the supplies for injection, as well as the monitoring that we do.
And can I inject something about the cost? The way I look at my health is I'm going to put my money into my health today, and it's going to cost me a lot less in the future as a result. And I get to live fully right now. And so when I think about things like TRT, because estrogen comes along for the ride, which is something we haven't really talked much about, meaning like if you go on TRT, your estrogen levels are going to come up too. And estrogen is really important as well for things like elasticity in your cardiovascular system. And among other things, it's really, really critical long-term for long-term health, shuttling calcium into the bone structure, things of that nature. I mean, pretty important. The TRT package, the process that you go through, means that you may not have to go on other drugs that will cost you in some form or another. You may not have to go on insulin. I think insulin is fairly expensive because you're likely going to turn around your type 2 diabetes, or you may not have to, may be able to come off of those things. You can come off of SSRIs potentially because maybe you're depressed because you have low T. And all the chronic disease states that crop up that are so terribly expensive, they can, again, if you manage your health in a holistic fashion, they can go away. And so I think it's cheap. It's like an investment in my ability to do the things that are really important to me, like growing stark and being a good husband and a good father.
I'd actually like to compare something else too. So, the drug that's actually getting a lot of attention in the media and is Ozempic. I personally believe, and I've seen clinically, that when it comes to losing body fat and reversing diabetes, testosterone is way more effective and a lot cheaper, which is interesting. And Ozempic, as you guys might know, like without insurance coverage, it's about $2,000 a month just for that medication. And it comes with a wide variety of side effects and, unintended effects. But we've had many patients who were, many cases where they've come to us already on Ozempic, and that medication was actually getting in the way of them of losing more fat, gaining more muscle. But we were able to switch them over to testosterone, and they were able to progress further with their body composition goals and reverse their diabetes. So in a very integrative, holistic approach, that can be done with testosterone. So if I had to choose between Ozempic and testosterone, I would go for testosterone 100%. And I can prescribe Ozempic. It's just it's not, I don't think that's the way.
Such a buzzy concept right now. And the drug Ozempic, it's kind of, I see all the headlines, but you're seeing better effects here. And so many things have been answered, guys, through your very thorough questions. Like, what is the success rate? You're saying you've had a couple of people over the last 7 years who have decided not to take anymore, right? So the success rate at Stark, in the way that Stark handles this, I would say is very high, correct? You're seeing very happy patients come in and have their life turned around by supplementing their life with TRT when needed. And so that's one of the questions. And there's a few questions about men and women taking testosterone in the instances when women need to take testosterone. If someone wants to field that question as well.
We do prescribe testosterone for women, and usually it's the form they don't need as much as men. So we can actually do topical creams for our female patients. They love it. It's a very interesting topic because we women actually have more testosterone floating around in our system than the other sex hormones. But the way that it's reported in the lab, they're actually using different units to report it. They're using the units that you would typically use for a man. But if you actually use the same units to compare estrogen and testosterone, we actually have more testosterone. But it's important for libido, important for drive. I actually listened to an hormone expert talking about how one of her patients actually reported being able to learn different languages or remember an old language that she learned previously and do math better. So once again, it's a brain hormone for women, just like it is for men. We just don't need it as much, but it is crucial. Now, I'll have a bit of a caveat that there is a condition called PCOS, polycystic ovarian syndrome, where these female patients actually have abnormally high testosterone, and that's usually from insulin resistance. So that's a bit of a different topic, but for the most part, I've put a lot of female patients on TRT as well.
If you're ready to get started and you've been convinced by this expert panel and the real life experience of Todd, who, if you haven't met Todd in person, is a true physical specimen. And as I mentioned before, is a mentor to me and a real inspiration, and has an amazing story and an amazing drive, and has built an incredible team of people and an incredible facility, but really a one-of-one, incredibly unique, full, comprehensive look at wellness, health, longevity, fitness, state of mind. It's a great community. I applaud you, Todd, for what you've been able to pull together. And I'm thrilled to just be here and have learned from you guys. It's experts that I'm lucky to have on my team, helping me be the best me I can be as well. So
thank you, JT. I guess, there's a big topic that we didn't touch on, which is TRT and its connection to prostate cancer. I think that's probably one of the biggest, most scary reasons, in addition to the fact that testosterone tends to be vilified. The reasons people delay or never go on it, they're really afraid of it. They hear about that from their primary care physician. And when you get into the origination of that research that indicates that there's a causation of prostate cancer from TRT, you'll be shocked at how ridiculous it all is, actually. And back to Dr. Morgan Taylor, he states that there is, in fact, no correlation, no causation between TRT and prostate cancer. And so that's a red flag. If your PCP says you should be afraid of getting prostate cancer, I'm not going to put you on it because of that. Maybe you should go shop for a new doctor. As a patient, that's my perspective.
I want to add one thing to that. Actually, there's more evidence that low testosterone, hypogonadism, is correlated with more aggressive forms of prostate cancer.